Hello everyone. Today we are going to discuss about oral suction. I'm Ms. Jansi. Let's see what are the objectives. At the end of the lecture, the learners will be able to define what is suctioning, list the assessment and articles required, enumerate when to do and when not to do the suction, describe the procedure of oral suctioning, and also enlist the complications. So what is suctioning? Airway suctioning is a way of removing excess mucus from the back of the throat and upper airway by insertion of a catheter or Yankauer suction via the mouth and application of suction to clear the secretions. Assessment. First, we should initially assess. So, recent secretions, what is the volume and color of it, breathing rate of a person, breathing effort, palpation, feeling their chest for presence of secretions, color of the face and lips, especially check for either pale, red or blue face and lips, irritability or discomfort and pain, or is the patient's color of the body and limbs is looking different, how the patient is maintaining the oxygen saturation, is oxygen really needed before a suction, all these things to be assessed. Articles required are suction machine, a working clean with all the pressures checked, oxygen available, catheters, hand washing and gloves, tissues if required. Okay, when to do the suction and when not to do the suction. Where there are signs of excessive secretions in the upper airway which cannot be cleared by coughing alone, where secretions are causing respiratory distress and making breathing difficult. And when not to do. When there is altered clotting or active bleeding from the airway, we are not supposed to do a suction. And when there is a severe wheeze. Preparation. Allow at least 1 hour after food if possible. Postural drainage, percussion if required to be done. Position. Side lying if possible if at risk of vomiting. Nebulizers can be initiated before and pre-oxygenation if required. So these are the things to be prepared before we give or do suction. Okay, what is a pressure? In hospital units, suction pressures are measured by 15 to 18 kPa and lateral portable suction pressures are measured in mm of Hg, that is 112 to 135 mm of Hg. So these are the catheters. So there are different French used for different set of patients. This is both for pediatrics and for the adult. So open the appropriate size sterile catheter and connect to the end of the suction tubing. Then apply a pair of clean gloves. Using a clean technique, remove the catheter from the cover. With no suction applied, slide the catheter gently into the mouth over the back of the tongue into the top of the airway. Next, apply suction by putting your thumb over the suction catheter hole. If patient coughs before this, apply suction straight away. Keeping suction applied, withdraw the suction catheter slowly, making sure that the available secretions are cleared effectively without rotating the catheter. If a block is felt when sliding out, take off the suction immediately. Once catheter is out, remove glove over the catheter and discard it. Wash hands and replace the articles. So this is Yankauer suction. Open the appropriate size sterile Yanker and connect to the end of the suction tubing. So this is a Yanker suction. This is a connecting tubing. So here is a standard tip and here is the bulb tip where it is having a bulb on top of the tip. So apply a pair of clean gloves. Using a clean technique, remove the Yanker from the cover. Slide the Yanker gently into the mouth over the back of the tongue to the top of the airway. Withdraw the Yanker slowly, making sure that available secretions are cleared effectively. Once the Yanker is out, flush it through and place the packaging back on to keep it clean. What are the complications? Trauma and damage to the lining of the airway or the windpipe, introduction of infection through poor hand hygiene technique, decreased blood oxygen levels, that is saturations, low saturations, plugging off secretions or blocking the airway, altered heart rate, changes in the blood pressure, vomiting or gagging, prolonged coughing leading to rise in blood pressure or the heart rate, collapse of small areas of lungs, patient distress or anxiety, and loose teeth. These are the complications of suctioning. Hope you understood the suction technique, do's and don'ts of when not to do and when to do and why it is contraindicated. So these are the references I had taken and thank you.